Hi, everyone. This is Sean with the MassSupport Network, here with your COVID-19 update for Friday, March 26th, 2021. Well, fortunately, in places where cases are not plateauing, they are back on the rise. Worldwide, we crossed 125 million total cases of COVID-19 just in the last day, which is about 3.9 million more than last week, which 3.9 additional new cases, which is 900,000 more than we had the previous week. It's a definite uptick there. Here in the United States, we saw about 400,000. That's slightly higher than last week, a couple thousand. Not enough that I'd really call it a wave or a surge or anything yet, but still trending upwards. Here in Massachusetts, unfortunately, we are definitely trending up with 14,000 new cases in the last week, which is almost 4,000 additional cases from the week before. Deaths are going in different directions. Worldwide, we saw 68,000 deaths, which is an increase of about 10,000 from the week before. The United States saw just 7,000 people die from COVID-19, which is 2,000 fewer than the week before and trending to some of our lowest levels in a long time. Here in Massachusetts, we saw about 342 deaths, which is about 134 more than last week, which is probably due to just reporting times rather than a massive surge like that. When we look at this, I normally focus on just the United States and Massachusetts, but I want to take a quick look at the worldwide case, as it is trending upwards significantly, almost by a third. So this is the last week where the cases are highest by population. And while the United States, Brazil, and India are still leading the way in raw cases, Europe is driving a lot of the spread right now in terms of cases by population. And also when you combine the countries together, you get quite a lot of new spreads. They're having a lot of difficulty with their vaccine rollout over there. And while we are kind of plateauing, they're definitely spiking in Europe. And Brazil has never really quite recovered. It still continues to put out some of the highest numbers in the world. When we look at the United States, we can see, looking at the daily trend in case counts, with the red line being the 7-day average, it does appear that it is starting to tick upwards there, which is not good because those little ticks, as we see back in the fall, back in the summer, those tend to grow bigger because these things grow exponentially. So more cases turn into even more cases rather quickly. Even if it's not actually going upwards and it stays at this level, it's still not a great place to be. As you can see, we're still just below that summer surge, maybe late August level, perhaps a little higher than we were at this point here before the lower plateau of the fall. And just being at plateau at all is just not good. As you can see in late spring and early fall of last year, we stayed at these levels for a long time, and that's kind of what allowed us to go back into a surge. Just the high number of circulating cases meant that it was there. And I think, part of this may just be people kind of relaxing now that the vaccine is out there and not being as safe as they should be. When we look about where this is happening the most, looking just in terms of population, the Northeast is still some of the hardest hit places. We're still seeing some of the most. Massachusetts is not as high as some of our neighbors, but we are still seeing quite a lot in this region. And, my hope is that the warmer weather we've had this last week may turn some of that around, just because when you're able to be outside, that's, there's less spread that way. It just makes makes it easier for people to do things without having to be indoors together. But a lot of this is to just relax restrictions that are allowing people to do things that, a month ago we didn't consider safe and are still not really that safe. When we look at hospitalizations, that's unfortunately coming to a plateau as well. There is still a downward trend from last week, but when we look at just the last couple of days, it's not really moving downwards. We are at our lowest point since, October, which is great. We're not even that far off from our lowest point, since the beginning, which is going to be in the mid 20,000s. not a great place to be at. When spread across the entire country, it doesn't put a huge burden on our hospital system. But as the case counts plateau or come back up, the hospitalizations are going to stay there too, and that is a problem. And part of that is new admissions. This chart shows not the number of people in hospitals, but the number of new admissions to a hospital. And it's, 0.1% is not a big increase here. That's the change in the 7-day average. But that's still maybe a trending up. We'll see this change before we really see a big change in the actual number of total hospitalizations. And it could just be because we had a big day the other day, and sometimes that'll happen. But as this starts to tick upwards, we'll see the others going up as well. Finally, deaths, which are dropping/plateauing. These will be the last ones to plateau after the case counts level out. So we may still see a few more days of dropping death counts. Again, we are still averaging over 1,000 deaths a day, which is not a good place to be. But that's where things are. We're kind of at a major turning point here, one way or another. Either we can get to a point where we can start to really turn this down, or we'll start to see things pick up again in the next couple of weeks. And sometimes I talk hopefully about the weather, but we have to remember, of course, that our initial surges were back in April and May before we understood this. So there's very much the possibility to see another surge, even with a lot of vaccines out there. Now, this one may not surge as much if there is a surge, because a lot of the people who are most at risk for death are the first people to get vaccinated. So we may see case counts or hospitalizations increase and deaths not spike as much result, which would be something there. It's something to watch out for. Look at developments, a bunch of stuff this week. First off, the president has said that administration's new goal is to give 200 million vaccines by April 30th. That is 200 million vaccines in 100 days since the administration took office. This is double their initial goal, but it's another goal that we are well on our way to making. We've already crossed 130 million vaccinations given. Some people still say this goal is not lofty enough. We should reach even higher. But we are also with the president also saying that we hope to have the vaccine eligible for everyone by May. We are well on our way there, so at least that is promising. In the continuing AstraZeneca drama, the final data came through saying their shot is about 76% effective. This is after, of course, the fallout from their initial reports, which said about 79%. When those reports were called into question for using some out-of-date data, and it was another blow to AstraZeneca's already shaky public image. And as many people have said, it looks like they made a good vaccine and did a terrible job marketing and rolling it out, making a lot of what Dr. Fauci called unforced errors. But it is apparently a very solid vaccine, even if they have not been very good in displaying the data and about it. A new study showed that mothers can pass antibodies to infants, both in utero and via breast milk, which is a very hopeful and promising thing. Also, that is, many states do consider pregnancy to be an underlying condition for getting priority for COVID vaccination. So this is just one more reason why that is good, that this can, you can get 2 for the price of 1 with your vaccine by protecting both the mother and child. So a little bit of hope there. Also, good news for children. Pfizer begins testing its shot for children. That's children 12 and under this week. So a couple of months, we may have a vaccine, another vaccine. Moderna is also working on theirs for children, and we can completely vaccinate our population, which is going a bit further towards making sure that everyone is completely vaccinated at all ages. You can find our sources at the New York Times, mass.gov, and CDC. And for more for the MassSupport Network, you can find us on our website and on social media. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.